In Illinois, lung cancer is the leading cause of cancer death and the third most common cancer. Dr. Neelu Puri is the associate professor in the Department of Biomedical Sciences at the University of Illinois College of Medicine, Rockford. She joins us now to talk about the importance of lung cancer screening. Why is lung cancer so prevalent here in northern Illinois?
So we do have a higher smoking rate in especially in Winnebago County and some parts of northern Illinois. Plus in Winnebago County, we also have a slightly higher level of radon. And so I think these are some of the contributory factors. In Winnebago County, we have 22% higher mortality rate in comparison to the national rate. And in Ogle County, we have 30% higher mortality rate compared to the national rate. So it is very important that people who live in these counties, they go for screening, especially smokers. It's very, very important.
What type of screening is available for lung cancer?
So this is called LDCT screening. And actually, the people should go to their family medicine physician, and they could get an appointment with for the LDCT screening from their family medicine physician. And lung cancer screening is done by our 3 local hospitals. They can go to OSF St. Anthony, Mercy Health, or UW Health Swedish American Hospital, and they can get themselves screened.
Is this a blood test, or what kind of test is it?
No, this is actually a low-dose CT scan, and the LDCT is actually using 90% less radiation than the regular CT, and the accuracy of LDCT is 20% higher. So it's just a CT scan. So it's very painless procedure. You just have to lie down and you have the scan, and then you have the results of the scan. And that is again sent back to your family medicine doctor. And then you go back to the doctor and discuss with the doctor what the results are.
Why is it important to catch lung cancer early?
So lung cancer is a very serious disease, and most of the lung cancer actually is detected later. 28% of lung cancer is detected at early stages. And at early stages, the 5-year survival is 65%. But when we detect lung cancer later, which is happening in more than 70% of the cases, the 5-year survival is only 10%. So it is very important that we detect lung cancer early, because if we detect it early, we can save that person's life.
Right. Now, you mentioned smoking is a big risk factor. What are some of the other risk factors? Is there any certain demographic that's affected more?
So it's interesting. Most people think that lung cancer is only prevalent in smokers, but lung cancer is also seen in non-smokers, especially 10 to 20% of people who are non-smokers, who are non-smokers also get lung cancer. And radon can also cause lung cancer. In addition to that, pollution can cause lung cancer. So there could be very many causes of lung cancer. It is not just smoking which is a cause, and there could also be genetic factors which can cause lung cancer. And in non-smokers, you see more lung cancer actually in women in comparison to men. So the dynamic is a little bit different for non-smokers.
Very interesting. So it's important to talk to your family doctor.
Absolutely. We should go to your family doctor, talk to them if you're a smoker. And I just wanted to give the guidelines for smoking. You have to be 50 to 80 years of age, and you have to smoke more for 20 packed years. You could be a smoker, a current smoker, or a former smoker. 20 pack years means that you have to smoke 1 pack a day. That is 20 cigarettes per day for 20 years. So that is the criteria. So you have to meet this criteria. You can also find a lot of information on our Northern Illinois Lung Cancer Screening Project. So this is actually on the UIC website, and we also have a Facebook page. In addition to that, you have the American Cancer Society also has a lot of information on screening criteria and lung cancer.
A lot of resources available. Doctor, thank you so much for being with us this afternoon. We appreciate it.